عليكم السلام.
اسمي أحمد مديل، أنا دكتور اليوم. كيف حالك؟
الحمد لله.
ممكن أسألكم سؤال؟ إيش اسمك؟
اسمي سلمان.
من وين؟
من الرياض.
كم عمرك؟
عمري 30.
متزوج؟
متزوج.
عندك أطفال؟
نعم عندي 2.
طيب كيف ممكن أساعدك اليوم؟
والله يا دكتور، أعاني من خوف. أنا أعاني من خوف خصوصا بوظيفتي. يعني أنا وظيفتي تتعلق بإني أبحر على سفينة لو أقع لأوقات طويلة يعني بعيدا من البحر الواسع، فأشعر بخوف وقلق منها رهيب.
طيب ممكن تكلمني أكثر عن الخوف هذا اللي تحسه؟
بحكم وظيفتي أنا أشتغل شيف. أنا أشتغل يعني شيف سفينة سياحية، والشيء هذا يتطلب مني إني أبحر، فأنا بالغالب أكون يعني طبيعي ما أشعر بشيء إلى أن تبحر السفينة وتبعد يعني عن الميناء. أبدأ أشعر يعني بخوف رهيب جدا، وأبدأ أتعرق وأحس بخفقان، ويعني حالتي يرثى لها.
من متى بدأ معك هذا الخوف والقلق؟
صار لها معي سنة.
خلال هذه السنة هل حسيت إنه تحسنت أو زاد يعني القلق أو الخوف؟ هل تحسن معك أو زاد؟
لا زاد، مع وظيفتي زاد. أنا قلت لك يعني إنه أبحر لفترات طويلة، يعني تستمر ممكن الأسابيع، ممكن الشهر، يعني بحر متواصل. فحتى يعني بوظيفتي ما أقدر أديها بعلاقة من الوجه بسبب خوفي، والخوف اللي أشعر فيه بالبداية بالنهاية يعني ما يختفي، يتحول إلى قلق مستمر.
كيف أثر عليك في الوظيفة؟
يعني ما عاد أقدر يعني أطبخ نفس ما كنت أول، أو نفس ما أنا يعني في بيتي أو في المكان اللي كنت أشتغل فيه سابقا. الزبائن صاروا يعني مو صار الزبائن من يعني توظفت بالسفينة يشتكون بشكل متواصل. أنا ما كنت يعني زي كذا، ولا كان عندي زبائن يشتكون من الطعام أو جودة الطعام.
طيب بالنسبة لحياتك في المنزل هل أثر عليك هذا الشيء وكيف؟
لا، في المنزل يعني حياتي طبيعية. يعني مكان ما أشعر فيه لا بخوف ولا قلق ولا توتر. منزل.
معليش السؤال بس، علاقتك الزوجية بعد مع زوجتك هل صار في تغيير تحس؟
يعني إلى حد ما العلاقة ماشية بشكل كويس، إلا أنه يعني بسبب المشاكل اللي قاعد تصير لي من خوف ومن قلق أثرت شوي يعني على الحياة الزوجية، و يعني مودي بشكل عام سواء مع الأهل ولا مع غير الأهل يعني شوي أقل ما كان عليه.
تمام. طيب بالنسبة للخوف والقلق يعني هل صار معك شيء حادث أو شيء أدى إنه يصير معك هذا الشيء الخوف؟
الخوف يعني بدأ معي من وظيفتي. أنا ما يعني بحكم حياتي سابقا ما كنت يعني في مكان في بحر، أو ماني متعود على البحر، أو فلما توظفت وأنا كنت يعني معتاد لهذه الوظيفة، ولما ركبت السفينة وشفت أن يعني بعدنا عن الميناء والبحر واسع وأي شيء يصير ما أقدر أهرب يعني من السفينة، وحتى لو كان في مساعدة ما راح تجيني بالوقت يعني المطلوب. فكل هذا يعني بدأ عندي هذا الخوف.
الخوف هذا يصير معك في السفينة بس ولا؟
لا من بعد ما يعني توظفت في السفينة وبدأت بدأ معي هذا الخوف، صار برضو معي مستمر حتى في المدينة. لما أروح مثلا أماكن مزدحمة، خصوصا إذا كنت طالع لحالي يعني ما معي أحد، ما أرتاح، أبدأ أخاف وأقلق.
قلت لي يصير معك خفقان وتعرق؟
نعم يصير معي خفقان ويصير معي تعرق والنفس عندي يبدأ يعني يصير أقل.
تمام. طيب بسألك سؤالين، بالنسبة للمود حقك هل حسيت بأي تغيير في خلال هذه الفترة؟
نعم، مودي مو نفس مكانه. كنت شخص ملتهي أغلب الأوقات. مودي من بعد الحالة هذه اللي جتني ما عاد هو مثل الأول، صار أقل.
نعم. تمام. طيب هل عندك أي هوايات تحب تسويها؟
هوايتي هي وظيفتي، أنا أحب الطبخ.
طيب بتحس إنه قل حبك للطبخ أو؟
للحين عندي اهتمام بالطبخ ولكن مو على السفينة. نعم.
أوكي. تمام. طيب بس معليش على السؤال، بس بعض الناس يحسون إنه ممكن يتخلص من هذا الشيء، إنه مثلا ينتحر أو ينهي حياته بسبب هذا الخوف والقلق. هل قد فكرت بهذا الشيء؟
لا أبدا، بالعكس أنا أصلا بدأ معي الخوف هذا يعني لو صار لي شيء ممكن أموت ما حد يقدر يلحق علي أو ما أقدر حتى أهرب.
فما فكرت
أبدا.
تمام. طيب ممكن أسألك عن طفولتك، هل تعرضت مع مثلا تحرش أو تعنيف كذا في طفولتك إذا تذكر، أو صار معك شيء حادث كبير؟
لا يعني أنا والدي كان يعني يستخدم يعني ضرب تربية، لكن بس هذا اللي حصل لي في طفولتي. باقي طفولتي كلها طبيعية.
ما تحس إنه أثر عليك؟
لا.
كيف نومك حاليا؟
أنا شوية أكثر يعني من المعتاد، ولكن مو ساعات طويل يعني إلى 9 ساعات إلى 10 ساعات.
ما حسيت إنه حصل تغيير بالنسبة للنوم؟
لا، هو زاد شوي.
أوكي. طيب بسبب هذه المشكلة معليش السؤال، بس هل تعاطيت أو فكرت إنك تتعاطى مثلا كحوليات أو أي مخدرات أخرى؟
والله يا دكتور هو السؤال شوية محرج، ولكن في أوقات يعني على السفينة لما يعني أكون بالحالة اللي قلت لك عليها أشعر بقلق مستمر، خصوصا يعني إن القبطان يعني أجنبي ويجيب المشروبات الروحية والأشياء هذه، فصرت أحيانا يعني آخذ شوية عشان بس القلق.
وتحس إنه يتحسن القلق؟
نعم شوي مشي يعني مضي
يعني تقريبا مرة بالأسبوع شيء زي كذا؟
على مدى السفينة يعني كل ما جتني كل ما بدأ يزود معي الخوف أكثر والقلق أكثر يعني ممكن آخذ شوي.
تمام. ومعليش السؤال، هل أنت مدخن؟
لا.
ما تمام. أوكي. بالنسبة للأهل والأسرة، هل قد أحد صار معاه مثل هذه المشكلة؟
مثل هذه المشكلة لا، ولكن يعني في من أخواني عندهم مشاكل نفسية اكتئاب وكذا.
تمام. طيب هل عندك أي أمراض مزمنة؟
لا أبدا.
قد سويت عملية من قبل؟
لا.
تمام. وهذه أول مرة تجي طبيب نفسي؟
نعم.
أوكي. I think that's it for the history.
I'm not here.
اوكي. طبعا راح نعمل طبعا بعض الفحوصات عشان نتأكد من الموضوع أكثر. فممكن نشوف نقيس عندك، نعمل لك CBC ونشوف مثلا وظيفة الغدة الدرقية عندك. تمام. وفي فحوصات أخرى راح نسويها، مثلا نشوف هل في ستريس زيادة في العمل أو في البيت، وعلى هذا إن شاء الله نحط التشخيص المناسب. تمام.
اوكي.
ننتهي الستيج وهذه معاك ولا؟
خلاص يعني أي ملاحظات على سلمان؟ ولا تخافون يعني في الله لومة لائم، يعني ما تخاف. خايفين منك يا سيدي. ما سوى شيء غلط. خلاص والله هذا شايفه يعني بده يتغدى اليوم وبكره That's okay. What about أحمد؟ ايوه ما تخاف في الله لو مثلا
ما اعتبر الشغل او confidentiality او الكليات
شفت واحد
يا شباب الصوت بليز.
هذا
والله ما لنا هيكم تحلفون مصدقني.
هذا مشكلة يا مدير.
اوكي ايش رايكم في احمد؟ وين عيد الكلام حسن؟
الدكتور كنت عم بقول انه قبل ما يسال اسئله الكحوليات والدخان والاشارات ما اعطاه انه يسال معلومات سريه وحفظ بيناتنا. confidentiality.
Do you agree?
He
I
said
don't
no.
think- I don't agree.
I don't agree either. He said that he said it's a simple question.
راح عليك الغداء يا حسن. لك الله سبحانه وتعالى. So no, I think he did excellent job, good job. He prepared the patient well. I quoted him. More than one time he said that. Okay, he said that أكثر من مرة حقيقة. First of all, you know, معليش على السؤال، هل فكرت إنك تعاطيت كذا؟ So he prepared his patient well. And the other things he said more than once. Okay, تمام. Once I was in Turkey and was still, you know, telling the people, okay, تمام. Oh, ما شاء الله you are أنا بالتركي ما فهمت، لكن كأنه أتكلم تركي، فأيوة أتكلم تركي. تمام. Then you said more than once تمام. And that is تمام. Okay. So what else? I think again I know this is a faked situation. In your clinic, things will be different, but at least it will give you a chance, like if you are doing whatever practicing self-defense, karate, ولا كونغ فو, ولا تلعب شيء حاجة زي كذا. خلاص ما بنخاف منك. That means you train yourself, and then later on you will utilize what you have trained, you know. So I think maybe some anxiety. Now you can detect some anxiety in your colleagues, and I love this. It is again part of your training. That, you know, some people are more anxious than others, and this is normal thing. Okay? If you are anxious, please feel the fear and do it anyway. I repeat, and this is a title of one excellent book. Feel the fear and do it anyway. إذا خفت من أمر فقع فيه. سيدنا علي كرم الله وجهه. إذا خفت من أمر فقع فيه. Yes, there is some anxiety and it is expected. It is normal. It is. If you are not anxious at all, that means, well, that's raised the suspicion. But if you are a little bit anxious, that means this is really a good thing. Okay. في طبعا I love this. You know how that affected you. He can he utilized open-ended question in a good way. He assured him, and he reflected some of what he has. قلت لي بصير معك خفقان وتعرف. He repeated. That means this sense will give the patient that yes, you were listening to me. We're not in يعني حتطبخ لك مرتك ايش ولا امك ايش ولا whatever. I think that's okay. بالنسبة لي, again, he refers to something. He started to just refer to something. بالنسبة لي, I think, نسيت لي الآن. He asked about very important and nice things. What is your hobbies? ما هي هواياتك? And that's, I think, all of these things بيروح عليك غدا يا حسن. انتوا أمثالك, okay? Okay, tell me about your patient.
So Salman is a 30
بس
years
الله
old.
يبارك. لسه تعامل مع رجال شايب تعرف ايوه اوكي go ahead.
Salman is a 30 years old Saudi male. He came to the clinic today.
By the way, I love your scenario, okay? تاخذني معك بالسفينة. بس بلاش الشرب والحاجات.
He came to the clinic today because he started feeling anxiety and fear about 1 year ago. Anxiety and fear when he was sailing because his job is a chef on the cruise ship. So he started feeling anxiety and stress and
He
fear.
started to feel كذا. Thank you very much. Utilize simple past tense. This is very important. Okay, that will make life easy for you. Go ahead.
With palpitations, sweating, and chest pain, and shortness of breath. The fear wasn't only on the cruise ship.
Can feel chest pain.
Just tightness.
I didn't pick it up. Okay, let him go ahead.
Okay. His fear and anxiety wasn't only on the cruise ship. He mentioned that when he went out alone, he felt the same feeling.
Okay, great.
There wasn't any major trauma either before starting his fear and anxiety or in his childhood. His father was used some punishing methods like hitting him, but as he said, it didn't affect him. It
That's
didn't.
great. Okay.
Yes, he didn't have any major history like chronic illnesses or didn't have any past surgeries. He mentioned that while on the cruise ship, he sometimes used alcohol to reduce his anxiety.
See, thank you very much. Please, he's trying as if أنا مراسل الجزيرة وأنا عندي كذا كذا as if you are a reporter. Okay, so he is almost doing the same things. It's as if he is a reporter. Okay, so at least be a good reporter. If you don't want to be a real doctor or just interviewer, at least be a good reporter.
For his job, it affected his job because
His problem is affected his job. Affected again simple past tense. Thank you very much.
his problem affected his job because he mainly works on a cruise ship and he feels fear and anxiety.
He's anxious. Okay.
Yes. For his family and his life at home, he didn't have. It wasn't very remarkable. Didn't have any the same feelings in home at all. His marital life was good. Didn't feel that much. He noticed that his mood was a little bit low. His sleep, he said that it increased a little bit.
Okay, that's good. That's good. Fair enough. Of course, two things, and you asked about that. Two things you need to mention. 5 S's. And even like review of the systems in the internal medicine. Now review the 5 S's. How severe? You said it is severe at home as much as at his work. The severity is moderate to high. The other things is, you mentioned something about sleep. What do you, and of course you said that, marital relationship, it's better to say that no sexual problem or no intimate problems. Okay, what else? 5 S's. Just please remember this 5 S's. Okay. We finished sleep, sex. What else? Mention something. He seemed not psychotic
He seemed not
or
psychotic, yes.
no hallucinations.
He didn't
What is
mention
that?
any
طبعا psychosis. ايش psychosis?
Positive symptoms, negative symptoms.
Hallucinations.
Hallucinations.
Hallucination.
Delusions.
Delusions.
Negative. Negative. Illusions.
Okay.
Obsessions.
What?
Obsessions.
خربتها. What is?
It's positive symptoms.
He actually said that. Psychosis is
Psychosis is the hallucination,
hallucination,
delusion,
delusion,
illusions,
delusions,
social environment,
social withdrawal, social withdrawal, or see something more than that. Write your name and write your serial number, and this is a bonus, first bonus for you, and for you as well, but just write it down. If you want one left, symptoms of psychosis.
Disorganized behavior.
Thank you very much. Yes, silly behavior or disorganized behavior. Yes, okay. So you need to mention that there was no clear hallucination, no clear illusion, no clear delusions or abnormal thoughts, or no clear silly behavior or disorder. Okay, that's good. Okay, what is your mental state examination for?
For the mental state, for the affect, his mood was normal.
I prefer you to utilize, and please write it down, how to say the mental state. Regarding affect, use, put it down. Regarding affect, he has so and so. Regarding whatever, so that will make life easy for you. Okay. Okay. So regarding affect.
Regarding affect, his mood was normal.
Okay.
At the moment, at the time.
Okay.
Regarding his.
Do you think he was normal?
Yes.
Was he depressed?
No, he was not.
Was he anxious?
Maybe a little bit.
A little bit. Thank you very much. Yes, a bit anxious. And he wanted to show you that he is a little bit, alert. Okay. What else?
For regarding appearance,
Okay.
he is well dressed.
He was
well dressed.
reasonably dressed. He was reasonably dressed.
He was reasonably
Okay.
dressed. He had good hygiene. Regarding
Don't forget smelly. Don't forget he was a smelly or not. It's important. He utilized alcohol. So is he really in withdrawal or in intoxication? I don't want to say the difference regarding this issue. When we will reach it, we will discuss it. Okay. عشان كذا انا في اشياء كثيره بذهني على هذا. تفضل سؤالك.
إذا شرب قبل يومين 3 أيام مثلا خلاص وقف وجاء بعد 3 أيام لا هو لا withdrawal ولا
Of course, yes, you're right. Yes, that's true. مظبوط. You're right. ما يعني ما بيكون كأنك إنسان عادي. شوفوا حتى ممكن يكون رحلته طويلة وكذا لكن رجل يعني. By the way, don't be misled by the appearance of the people. I saw many patients who are really respectful, but they are drinking. Even I was really badly hit by one patient. It was one patient, one DIB. And I know him long time ago. During this Ramadan, he used to go to Egypt just to drink, sit with his girlfriend, and he come back. Please don't be misled by the appearance. People, الدين ما هو بالشكل, but anyways, okay? ممكن يكون له شكله كذا ومن أهل السنة والصلاح يكون العكس أو العكس. So please be objective. Okay, go ahead.
And regarding his behavior, he had normal behavior.
Okay,
Regarding to his perception,
okay.
he perceived everything well.
So there was no abnormal perception. Okay, go ahead.
Perception. Regarding his comprehension, he was well oriented and understood.
You can say orientation, not comprehension.
Okay.
Comprehension is something totally different. I don't want you to go with this. I give you something, to the point, practical things. Comprehension, understanding. This is the comprehension. Orientation is totally different. Awareness of the surrounding.
Okay, and regarding to his cognition, he had normal thought form.
But you didn't comprehension or orientation. Was he oriented for some recent person?
Yes, he was. I didn't
Did you ask him?
No, I didn't.
Thank you very much. Just to stop. If you forgot something and you want to tell your examiner that, well, he is oriented. Say it like this. Learn it. Put it down. He looked like oriented, or he seemed to be oriented, though was not fully tested or formally tested. Fair enough. أنا نسيت. لكن he looked that he is oriented. Okay? Don't lie. Be careful. If you don't know something, please keep silent. Okay? Don't lie at all. That irritates the examiner too much. He knows better than you. This is his expertise. This is why he is here. He is examining you. If you don't know, try to say something that you know. Distract him, but don't lie in your life at all. Okay?
So regarding his cognition, his thought form was normal, but
It's better to say no formal thought disorder.
okay, no formal thought disorder, but
That means age.
uh,
No what? No form. What are the formal? What is the formal thought disorder?
يعني يركب الجملة بطريقة صحيحة.
The two things. Formal thought disorder. 1, 2, 3. You remember?
The train.
No flight of ideas.
Thank you very much. No flight of ideas. ضيعت الفرصة على Okay.
Yeah, yes, no flight of ideas.
تذكر شيء تاني؟
Normal flow اسمها normal flow.
Well, do you think he has normal flow? Of course, when we are talking about the flow, yes, يعني طبعا we are talking about communication, talking, but that reflect the flow of the thoughts. لكن ما حندخل في العمق. That is okay. So, do you think that he was a normal flow thoughts?
Maybe a little more than normal in the flow.
That means accelerated.
Yeah, a little bit accelerated.
It's hard to swallow. Though he is a little bit anxious, I would like you to differentiate between anxiety affect and thoughts. I might be anxious, and maybe my thoughts could be more sharp, but not accelerating. This is totally different, okay?
And in the content,
Okay, thank you very much. Excellent, you're doing excellent.
he
إلى
had,
الآن إذا صار لي شيء حاجي عندك. Okay.
he had maybe, or not maybe, he had overvalued ideas
Okay, بطلت إجرام.
because of the fear isn't reasonable.
Don't commit yourself. في فرق ما بين irrational fear. في فرق بين irrational fear and any other thought disorders. Okay? So, what else? يعني في فرق ما بين overvalued ideas and irrational fears. Okay?
Yeah, he had an irrational fear of
Okay. What is his diagnosis, by the way?
diagnosis most probably agoraphobia.
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 Okay, في فرق طبعا. Okay. Agoraphobia. كمل. You said that the proper diagnosis خلاص خلينا نمشي. The proper diagnosis is طبعا في قضية مهمة إنه test of test of memory will follow the test of orientation for time, place, and person. Okay, لكن you know that's if you want to be systematic. باعتباره إنه agoraphobia ما ححاسبك، لكن if he is demented, of course ححاسبك because the main issue is the cognitive issue. Okay. Now, the main issue is phobias and anxiety and okay. Okay, so your working diagnosis, provisional diagnosis, and this is the way. Thank you very much. What are the positive things in the history? يعني كان يلست ايش الاعراض اللي كانت موجوده وبلاش الحشو الثاني.
He had fear, anxiety, palpitations,
okay,
chest pain.
Thank you for reminding me of very important question.
Sweating, chest tightness.
Okay. خلاص هذه الأعراض كوكبة من الأعراض.
تمام.
بكفي إنك تشخص. This is the way I would like you to think. بكفي هدول إنك تشخص agoraphobia. You said the diagnosis is اللون أصفر.
تمام.
فأنت شفت في يعني في قريب من الأصفر كذا ما بعرف إيش لكن you said at the end إنه the color of this diagnosis is yellow. Okay. But show me the evidence.
The fear wasn't only to a specific thing.
Thank you very much. Excellent. I'm happy to listen to this.
It was the idea of being in a place he can't go. Yeah,
See,
scared.
you know it. Yes. So fear and anxiety, just reformulate your thoughts. Anxiety symptom tick 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 كلها هذه اسمها anxiety صح. لكن anxiety thank you very much. أنت ريحتني من شيء مهم إنه it is not because of specific things. طب لا تجاوب. If it is specific things إيش حنسميها؟
Specific phobia.
Specific phobia like what?
Animals.
Animal phobias أعطيك كمان again another وين البونس معك كويس
أعطي نفسك.
أعطي نفسك بس خلاص. Okay. What else? And the anxiety either to be specific or to be because of aware of something or because of
Always you have anxiety.
always. What is this?
Panic disorder.
Generalized.
Generalized anxiety disorder. If so the anxiety في وحدة أخرى. إذا كانت الانxiety
Separation anxiety disorder.
No, the anxiety, I'm just classifying the anxiety. I'm helping you how to organize your thoughts.
Yes.
If you have anxiety, he mentioned two kinds of anxiety, generalized anxiety, specific anxiety, or
Trait anxiety.
Social anxiety disorder.
this is specific,
Specific.
performance anxiety. This is not specific. Well, again, specific.
It be occasional in.
Occasional, thank you very much. That means bouts of anxiety, which is ايش حنسميها؟ جت الانكزايتي مع اوكي situational not situational bouts of anxiety تكون انتم كذا الان فهمتوا الانكزايتي كلها well but not type of anxiety
Panic attack.
panic attacks خربت على غيرك الله يهديك okay 3 kind of anxieties first generalized anxiety disorders specific anxiety or أعطيك يعني تستاهل okay or occasional anxiety occasional anxiety that is bouts of anxiety which is panic disorder شيل هذا ايوه واعطيه الله يرضى عليك don't forget إذا ما حاطين serial number I will not take it please just pick up your serial number okay so panic disorders هذه bouts of anxiety or generalized anxiety disorders did you excluded panic disorders?
No, but he said, يعني on specific things, more specific, معلش. The idea.
On a special situation that whenever he will be outside.
Yes. So it is not always he will get the panic.
Do you think you missed to ask him
Yes.
about panic attacks? Thank you very much. This is mandatory, especially agoraphobia. What is your differential diagnosis before I will come to you?
Agoraphobia.
Agoraphobia.
ما
ايش اسمها بالعربي؟
فوبيا الأماكن المغلقة.
It is not your. Please don't answer like this. You are just أنت أخذت اللي عليك وخلاص ومبسوط يا عم. Don't waste the chances for your colleagues. First of all, the question for him first, then to you. أيوه.
بالضبط بس
أنت عربي ولا أنت عربي ولا يهودي؟
خوف من الأماكن المغلقة.
خوف من الأماكن المفتوحة. Okay. خوف من الأماكن المغلقة. What do you call it?
What is not plan?
Claustrophobia. Okay, so the differential diagnosis is agoraphobia. It's a generalized anxiety disorders.
might be a panic disorder.
Panic disorder or panic attacks. Stop. What are the differences between panic disorders and panic attacks?
Panic disorders is when you have several panic attacks, I believe 3 within 1 month. Panic attack is
Thank you very much. Yes, you're right. So it is just only the number of attacks. Just the numbers. Will be attacks or disorders, okay? This is the, you know. Okay, how to treat this patient? What is the investigation you will do?
Investigation for bio, we will do
Thank you very much. Okay.
for bio we will do a CBC.
Why?
Check for the thyroid hormones.
Relax. Take deep breath. You said CBC.
CBC to check the blood count. Is there is a
Why you request blood count for this patient? Keep silent if you don't have explanation. See? بتحط نفسك بمواد بايخة. Sorry, okay. Okay. Why? Should you order CBC? حدا معك أو حسن شو بيقرأ؟ Do you know? أبوك؟ والله أبوه was his well, he didn't say anything له ولا أبوه till now I discovered vitamin D is my friend في the hospital. I will let his father to pay for CBC for that. Okay, please.
Okay, so why do we order CBC if the patient has anxiety? There are certain systemic illnesses that can manifest with an increase of white blood cell count.
Okay.
This increased white blood cell can be an indication for anxiety.
What's that? What's that?
مثلا الأسلي and we
Why not to ask for rheumatoid or whatever SLE diagnosis?
because if there's a high white blood cell count, that would in itself indicate anxiety. That would indicate infection. Excuse me. Infection itself could be a cause for the patient to have anxiety.
Thank you very much. Yes, now I accept.
Thank you.
But there is no signs of infection.
But how do we know?
Oh no, of course, you know. It's by symptoms. Oh, do you have? Yes, I feel fever while I'm in the sailing. If you have a clue for that, you will ask for that. Other than that, your father will pay for that. Or for this investigation.
The bonus doctor.
Maybe it might be.
Yes, Fee.
The patient might be have MI.
Thank you very much. It is really, see, when one will go, the anxiety تبدأ يعني الواحد يلمع. Okay. Yes, and this is why I would like you to tell me the differential diagnosis. في عندك differential diagnosis غير اللي ذكرتهم كمان.
You only have one, so.
ممكن يكون specific phobia or something.
Why is there so many numbers here?
He mentioned something very important, which is MI, right? It's very important. And thank you very much. عدلتها يعني خربت مزاج بالأنصار. Thank you very much. Okay. Anemic patient. Yes, this is why, you know, CBC is, yes, thank you very much. If you have legitimate answer, if you have just explanation, that's good, excellent. But if you don't, of course, I'm sorry, you know, just you want to just say أنت بتعامل مع المستوصف وتاخذ فلوس and you are not honest. So yes, thank you very much. So give him a bonus, and give him a bonus. MI is why we are saying MI.
Palpitations and shortness of breath.
Palpitation, shortness of breath,
Sudden onset.
and
Sweating.
okay, sweating. كل هذه الأشياء could be not psychological. Could be.
Heart problem.
Thank you very much. Myocardial infarction. It's very important. This or any heart problem. You need to put organic differential diagnosis, and you need to put this in the top of the list. If I missed agoraphobia, not that big issue. If I missed myocardial infarction, that's big issue, right? So first of all, please don't forget to rule out organic problems. This is very vital. Okay, thank you very much. Give him the,
Yeah, sure.
please,
That's it.
Doctor, can you put myocardial infarction on the differential diagnosis?
say it again.
Can you put myocardial infarction on the differential diagnosis?
Myocardial infarction as a different, what I have said. Yes, of course. You should put it in the top of the list. The first one is myocardial infarction. Why it is not myocardial infarction? And that will affect, let me just finish that discussion. خلي ترى الدكتور خلدون يعني ما حفظ الصحبة what is the investigation? What investigation you will do for this week?
ممكن في البايو نعمل ECG.
Thank you very much. The ECG will include or exclude myocardial infarction. Yes. What else? خلاص هنسامح أبوك بالCBC. Okay. But you know why you know they give us legitimate explanation. This is why I requested CBC. Could be anemia, could be infection, could be yes at that time, so you know what you are saying, what you are talking about. Okay. What else?
For psycho,
Mhm.
we could use the chart for depression. We could screen for suicidal ideations.
Oh, of course that will be detected during interview, the suicidal. Like you are saying scales, okay? Scales means scales for anxiety or for depression, وعشان الوقت, okay? This is the investigation, the psychological investigation. The social investigation,
We could check the job place. There is any stress with the
thank you very much. At least you can just confirm if there any problem at, you know, so you know, so difficult to ask is well, captain or whoever, you know, it is not that serious issue. But you can just say, or you can just, well, no need to go, this is how you formulate it. No need to go for more social investigation since the issue is straightforward. This is how you treat this patient.
For bio, we can give SSRI.
I will follow biopsychosocial approach.
Yes.
Don't forget it. At your level, please, in order to, you know, to make it, to crystallize it in your unconscious. I will follow biopsychosocial, okay? Amran, Jawad. Biological, what you will give?
SSRIs.
SSRIs, which is
Citalopram?
No, don't tell me, don't look at me like this as if I am the criminal. والله ما أنا اللي اخترعت الإيسيتالوبرام. Okay. إيسيتالوبرام. Yes, إيسيتالوبرام. How much? 10 milligram. How frequent? أبوك ما حيوصفك في مستشفى دولي. Okay. You need, please, I spend almost 5 to 10 minutes explaining the drugs to my patient. First of all, you need to make sure أنا جاي عندك وما تعرف تكتب لي الدواء. والله be careful, this is major things. You need to know the medication very well. Sensing the responsibilities في من يراقبك إذا ما كان في أحد يراقبك. واحد، اثنين, you need to know everything about the medication. You need to explain this to your patient and tell I will give you this medication, this is the name of the medication, and please use the generic scientific name, not the trade name, okay? Citalopram, not Cipralex, not whatever, okay? So, and tell them I will give you just 1 tablet a day.
Oral.
Of course, oral. Thank you very much. And what you will tell your patient.
Duration.
About side effect.
Okay, I will tell him about the side effects, which is what?
Just for sexual dysfunction.
Sexual and what? بس السكس اللي Okay, somebody who is duration. Thank you very much. What you will tell?
6 months.
Okay, you should take it for 6 months. Besides something else? مع duration. Where's 6? خلاص مو بس هو. GIT. Thank you very much. Please just give them the bonus. What is that bonus? Write your bonus, you yourself, and him, and Hassan.
And the effect will start after 2 weeks.
كيف حبيبي؟
The effect will start after 2 weeks.
Thank you very much. الآن أخذت حقك بالكامل. Thank you very much. Please don't forget to tell them that you will take it once a day after lunch because of GIT problem, and it might affect your sexual performance. إيش بتساوي؟ بس سكس وخلاص. والله مسكين أنت يا شيخ. أنت متزوج إيش بتساوي؟ ما بياخذ ما بياخذ. اوكي.
دكتور ممكن تسوي
ونوز.
سوسايد ثوتس مع
ايش؟
ممكن برضه تسوي بالبدايه سوسايد ثوتس.
No, 666 what it will.
It's delayed.
Thank you very much. حد غششك اياها.
لا والله
خلاص اوكي خلاص.
لأن
delayed
usually
ejaculation.
people abuse it.
Delayed ejaculation. Thank you very much. Yes. Please give him the bonus. Delayed ejaculation.
Not decrease the sexual components, increase the sexual.
Again, the sexual effects of any SSRIs, especially is the least. هو delayed ejaculation.
So nothing in the early.
صلي على الرسول. Name, it might decrease the libido. You know the libido.
Sex drive.
The desire to have sex. Just only these two. Okay? And these are minor things. Assure the patient whenever you will stop this, everything will be okay. I used to tell my patients, somebody بيدعونا and somebody بيدعو علينا. Some people, they might have premature ejaculation. And when they give them Citalopram, whoa, thank you very much, you treated me. أما إذا كان هو عنده أصلاً delayed ejaculation وأعطيته Citalopram, فهيدي عليه برافو وعلى الإجابة كان So this is the sexual effects. Please don't forget to tell the patient, and this is very vital. Things will not start or improvement will not start before 2 weeks. This is very vital. Because people used to, you need, look here,
Something fast.
It is your responsibility to gain your patient. You want, you know, إنك تاخذ أجره. You want to help him. حتى لو هو ما نعاد. As if mentally retarded patient and he doesn't know what's going on. You want to get him. You need to help him. If he doesn't know, your job to educate him. Now you want to increase the compliance of with the medication. That means you tell them, you explain everything. Please take it for 6 months. Please expect that not next week or 2 weeks you will not have any improvement. So it takes at least 2 weeks, and it has some side effects. So these are the things that you need to educate.
دكتور أنا بهلا ممكن يصير discontinuation syndrome.
Thank you very much. It might this is very rare with escitalopram.
Agitation.
Do you know ايش اللي ممكن? What is the bad discontinuation syndrome?
Agitation, nausea.
No. Yeah, thank you very much. This is the discontinuation syndrome. Like which drug can cause discontinuation? It is different. Discontinuation syndrome, explain to them. ولا تخليني نكمل. When you stop any medication, there will be some sort of bad symptoms, but not withdrawal symptoms. Different from withdrawal symptoms. They call it discontinuation syndrome. What is the worst drug with discontinuation syndrome? Benzodiazepine يسوي withdrawal. No, antidepressants يسوي discontinuation syndrome. It's very bad.
I have a question, doctor. What about...
No, just answer
sorry,
the question.
What's the question?
Oh my goodness. What is the worst drug that can cause withdrawal? Not withdrawal, sorry, discontinuation syndrome. Venlafaxine. Venlafaxine. I don't like it. Venlafaxine.
ما مر علينا دكتور.
Venlafaxine.
ما مر علينا.
طيب الآن حيمر عليك. طبعا في أشياء كثير ما مر عليك يا عمران يا حبيبي يا.
Not included.
Well, no, this is why we are in the practical, as if we are in the hospital and we are, teaching you the practical things and proper things, hopefully.
Doctor,
Okay.
what about serotonin syndrome? What about serotonin syndrome?
Serotonin syndrome is this is something else.
Okay.
Serotonin, thank you very much for your, really good student. Serotonergic syndrome is increase the serotonin. Discontinuation syndrome is something because you stop the serotonin.
Okay.
You got it?
Yes, thank you.
Please, is it something related? Okay, because the time is, what you will do with this? You said that you give him escitalopram. What else? You said biopsychosocial.
Yes, for the psycho, we will do CBT, cognitive behavioral therapy.
ايش بصير في الCBT؟
نغير البيهيفير بالنسبة لهذا.
You change the behavior and the thoughts, cognitive behavior.
We change fear with the relaxation.
Thank you very much. في any last things you would say to your patient?
So educate his family.
Thank you very much. Excellent.
And tell him to come back again.
Thank you very much. لا أعطيك العلامة وأنا ما أدري متحابي لأبوه. سلم لي على أبو حسن. Thank you very much. Any questions? Other than that, let us have the other